One. Hey, everybody. Welcome to the Waiver Wire Selection Podcast. I'm Dr. Marco Nunez, Doctor of Athletic Training, and this is Landon Burford.
What's going on, everybody?
Welcome, everybody, again. So what we're going to be doing again, like we normally do, we're going to do a quick rundown of the current injuries among the NBA and any other sports, give you an idea of what's going on with the athlete, what it would be the timeline. Do you need to go pick up somebody as far as in the meantime? Can you hold on to him? Do you need to put him on IR? Or is it at this point where you have to pretty much waive him, get him off your roster because he may not be coming in for the rest of the year, and you need to go pick somebody up in their replacement? So we'll get started, Landon. So who do we have on I guess the injury lineup?
We got a lot of individuals, but with the NBA starting back today, we'll start off with the Pelicans. Where's New Orleans? Zion Williamson is out with a hamstring, suffered a setback in his rehab and will be sidelined for several more weeks, according to Christian Clark of the New Orleans Times. The New Orleans Times.
Yeah, so this is the thing about hamstring injuries, and this is one of the issues that I think if you did NFL fantasy football at the same time, and if you had Keenan Allen, you probably were a little frustrated throughout the whole past football season type thing. So hamstring injuries are very, very tricky. It's very often or common when an athlete, he feels great, he goes out there, pushes a little bit, the muscle's not quite ready, and then they can go ahead and re-aggravate it. Now, typical hamstring strain, if it's a minor one, it's usually anywhere between 2 to 4 weeks for a very mild hamstring strain. Now that he's re-aggravated the hamstring, there's a very likelihood that the New Orleans Pelicans sports medicine staff are going to be a little more conservative because they don't want him to come back and re-aggravate the hamstring. So you're going to probably expect him out probably for another 3 to 4 weeks minimum on this part, because now they're going to actually take the time. If that muscle re-aggravated, there's a higher likelihood of him re-aggravating if he comes back a little bit sooner. So he may be out for a longer period of time than most people kind of expect. So anticipate for at least another minimum 4 weeks until he kind of gets back on the court.
So he might be out for the season since they only got 22 games left, right? So 22 games left, right? So
at this point, it's going to be one of those tough things. So again, and this is something that we've talked about, depending where they are for the playoffs, where are their standings. I know at the beginning of the season and around November, December, they were doing great. I think they were probably ranked up. It's like second or third in the Western at some point. I think they might have been leading the division, or at least up there at some point. They've been struggling a little bit. Now that Brandon Ingram is back, he kind of helped them up, but he was also out for almost 8 weeks. So I think that's where they kind of took a little bit dip, because they had Williamson and BI out at the same time. So they struggled a little bit on that part. So hopefully we're going to see how they do. At some point, if they're making a huge run for the playoffs and they look like they're in a pretty good standing and they need Williamson, they might be able to get him maybe towards the end of March, or so to speak, try to do the kind of those last 3 weeks of a run to try to get into the playoffs and maybe get into a good position type thing. But if they're struggling and they drop all the way down to the tournament play-in type of thing, at that point, they may either sit Williamson out, see how they do, and if they get into the playoffs, then they may be hopefully get him in for the playoff type of thing. So expect him to probably come back towards the end of March, but even then, like I said, it depends on where the Pelicans are.
And then his teammate Larry Nance is day-to-day with a groin injury. Obviously, that just depends, but I'll let you go into more detail.
Yeah, so that's groin injuries and hamstring injuries are very common in basketball or any sport that does change direction from left to right and pivoting and turning. Groin injuries are huge in soccer, and they are predominantly huge in NHL hockey, because those are the muscles that you use to kind of push off the ice. You use the groin muscle to you use your glute to push off, and then you use the groin to kind of bring your leg in type of thing. So again, being in that area, in the pelvis area, part of your core stability area, it's a matter of trying to see how you do. Also depends on what kind of degree it is. If it's a very first degree, I also expect them out to probably be out anywhere from 2 to 4 weeks. If it's a second degree, they can be out anywhere between 6 to 8 weeks, especially in the groin area, because that's one of the huge stabilizing muscles for your core, and you can easily aggravate that injury type of thing. So it's just a matter of waiting and seeing how he does and how he progresses.
KD's supposed to make his debut, I think, tonight, but is he even on their injury report? Okay, yeah. They have him debuting March 1st against the Charlotte Hornets, according to Shams. But he's out with a knee, MCL specifically. Just, a potential update on that, or what's really going on with that type of injury?
Yeah, so an MCL sprain is one of the ligaments on the what's called the medial side, or not the deep inside your knee, but like more towards the inside of your knee. So you have four key ligaments in your knee. You have your ACL and PCL, which run inside your knee. They run kind of a little bit of an X, and on the outside of the knee, you have your LCL on the outside of the knee, and then your MCL on the inside of the knee. If a player gets hit on the outside of the knee and you see their knee kind of cave in, what's called valgus, there's very likelihood of spraining your MCL. Now, your MCL ligament is also very important. It's one of your stabilizers that every time you put your foot down and you start pivoting and turning, and that's your foot, you may aggravate it and you irritate it and you kind of feel some discomfort on that part. Again, an MCL ligament is not as bad as a hamstring strain type of thing. Oftentimes, if it's a very mild MCL ligament, it can be anywhere between just a mild 1 or 2 weeks, but we're talking about very mild, like you just kind of tweaked it. The location of the tear or the injury of the MCL ligament has pretty much a huge component of it and determines the timeline. If it's in the middle of the ligament, it's very common. That's very good. If it's more towards distal, meaning closer towards the foot, closer towards the insertion of the ligament area, that becomes more of an issue. Then we're looking anywhere between 2 to 4 weeks type of thing. So that could be a little bit more tricky on that part.
Okay. Let me see what else do we have here. Bradley Beal. I just saw this on the report. Sore right knee. Did not participate in yesterday's practice, and it's unclear if he will be available against the Knicks, according to Josh Robbins. I'm sorry.
Yeah.
Of The Athletic.
Yeah, so sore knee could be anything, unfortunately. I mean, it's something. Sore knee is something oftentimes determined as wear and tear. There's no specific injury, but he can be experiencing some chronic issues. It can be something as arthritis, that it just kind of got inflamed from jumping and landing and twisting, that his knee might have gotten a little swollen, a little sore. He may be experiencing like some patella tendonitis issues, that it's kind of a little irritated in that part. Nothing detrimental, nothing huge. It has to miss a huge amount of games. In this case, often when they say sore knee, it's kind of like a day-to-day type of thing. You tend to see this more with veteran players. I think you saw like LeBron James was out a couple of weeks ago with a sore ankle. And this might be the same ankle that he aggravated 2 years ago, with the ankle sprain, and then even last year. Once you get old enough and you've had so many injuries to that specific joint, you start getting arthritic issues in that part. So you just start experiencing some soreness, wear and tear on the body type of thing. So this part, there's no timeline. It's more like, hey, how's the player moving, how the player's feeling, and then kind of be able to go. So he's just, like I said, it's pretty much day to day. You just have to kind of keep updated and see what's going on with him in the lineup.
So Maxi Cleaver, I'll continue to skip around. He did some work yesterday with the Mavericks, because I was at the practice facility, but obviously he's got the hamstring. He's been out for a while, right?
Yep.
They say he's very close to returning, according to Tim McMahon, to some extent. But they say they're going to go at Maxi's pace. Again, it's a hamstring injury, but they said they're not going to rush him back. Obviously, that's what Jason Kidd said yesterday. So him being very close and them rushing him back are two different things, right? You know what I'm saying? So.
Correct.
Go at his pace is what is the direct quote is what he said yesterday. So
correct. So it's almost they're contradicting each other. So So the positive thing is that he's back on the court and moving. Okay, that's a huge plus type of thing. Oftentimes, what I'm looking for is that once they say, hey, he's returned to practice or he's scrimmaging with the team.
Mm-hmm. I wouldn't say scrimmaging yesterday. I wouldn't say he was scrimmaging yesterday.
That's what I'm saying. So not until they say, hey, he's actually the player scrimmaging with the team. That's a huge positive. Then that's what tells me he's very, very close. Because if he's not scrimmaging with the team, that tells me that within the next 5 to 7 days he's scheduled to return, because now he's been cleared to be able to do unrestricted movements, all contact activity type of thing. That is what I'm always looking for. But now if they say, hey, you know what, he's back on the court doing one-on-one or by himself with the coach, that doesn't tell me that he's pretty much anywhere near close. He probably has another maybe 2-3 weeks. Usually what happens is they'll start doing like a one-on-one with the player. Then they'll have them scrimmage like a half-court 3-on-3. And then eventually once they return to full scrimmage with the team, that's when they're pretty much close. So what this sounds like is that he's not close, but he's not anything like compared to Zion.
Okay. Somebody else that has already been ruled out for the rest of the season, but we could have, anybody could see that the way he was moving before the season, that, we would have been surprised if he even played this season. Former Laker Alonzo Ball, obviously he's in Chicago. From what I've heard, they don't know what's wrong with him. Yeah. Being that you're actually in the medical field on that side, can you give us a little bit more insight of what might be wrong with his injury right now?
I wish I had the definite answer for you right now and for everybody type of thing. If I did, I'd definitely be able to call my friends over at the Chicago Bulls. The strength coach used to be, I think, the director of sports medicine up there with Chicago Bulls used to be with us here with the Lakers back then as far as our strength coach type of thing. Mm-hmm. This is kind of like, it sucks for Lonzo in a way because this is some of the issues that he's been dealing with for like the last, this is the second year in a row, right? Mm-hmm. It started last year, I think, towards the beginning. He had some issues. And I think I had read a report over the summer that they thought that they might have finally figured out what was wrong. They thought that he had some debris that was putting pressure on a nerve that was irritating his leg, and he was having discomfort. And they felt that was the main culprit of this whole entire thing. They went ahead and removed it. They did the debridement, and they felt that he was now back on track to returning to play. Unfortunately, that's not the case. It's just kind of interesting to see, what's going on with it. It sucks for him. I mean, this is the second year in a row that he's not going to play because of his knee, and unfortunately, they still don't know what's going on. Oftentimes, some of these small little nagging issues for athletes tend to be more frustrating, not only for the athlete, but for the sports medicine staff. Oftentimes, it's easier, hey, I'd rather you break a bone, and we know it's a broken bone. We either have surgery, we put in a cast, and we're ready to go, versus some of these small little chronic little issues just linger on and can be very frustrating.
I know now, for the people out there that don't know this, the Bulls are not the ones giving this diagnosis. They're only consulting with his doctor that he went to in California, as far as correct? Am I right about that?
Yes. My understanding is that he came to see a doctor. Now, as athletes in the NBA, you're allowed to go get second and third opinions type thing.
Correct.
But what I recall is that there was a list of doctors that the NBA can provide for second opinions that were pre-approved by the league and the Players Association. At some point, if you go to a third party, meaning a doctor that's not part of that list, you have to get approval from the team and approval from the league to be able to go see this. So it becomes an issue where either the player is not, wants to try to see what other options they have, and they maybe go outsource and go somewhere else and see, hopefully be able to get what they have fixed, so to speak.
That makes sense. Let me see. Jamal Murray, I would like to ask, but it doesn't give exactly what his injury is. Mm-hmm. It just says he's out. Are you familiar with what's going on with him?
With him, I'm not. No.
Okay. Let me see. Ricky Rubio.
Now Jamal Murray. Well, he's been playing all year. I think I've seen a couple of games.
He's been in and out, so I'm trying to figure out what's he out right now for.
So now he's also returning from an ACL injury from last year.
Okay.
So here's the thing. The interesting part about it is that even though most athletes return from an ACL injury within the year, the most common number that nowadays are, therapists and athletic trainers are realizing, and the studies are showing that oftentimes it takes up to 2 years for an athlete to be able to return to close to 100% of what they were before from an ACL injury. So even though they return to a game and start participating like within 8 months or a year, there still may be some lingering issues that can be occurring. So this may be something potentially associated with the ACL, but it's just kind of chronic issues. He might be experiencing a little bit of maybe patella tendinitis, which is common. He may be experiencing a little kind of hamstring tendinitis issue, something like that are associated with it. You may get a little bit of swelling still on it, even for the next year after that. That may be some of the issues. But if they're not identifying anything specific, it just may be some residual issue that he's having from the ACL, and more importantly, the fact that there's I think they're still number 1, number 2 in the Western Conference. They're going to need him. Yeah, they're going to need him for the playoffs. So this might be more of
a rest day.
A rest day, time management. Now, here's the thing about it: because of the NBA, you can't sometimes just tell a player,
"Hey, rest." Yeah, that's right. Yeah.
Yeah, rest out, and you've got to come up with some injury, unfortunately. So this may be attributed to his days of being able to rest right now and try to get him ready for the push for the playoffs. And it just may be something simple as that. Hey, we need to kind of conserve him for the playoffs. He's coming back from an ACL injury. He cannot play the full 82 games. More importantly, we need him for the full 62 games in the playoffs. So this might just be a smart move by the Denver Nuggets and their sports medicine staff.
So they got Ricky Rubio out. He's not playing against the Nuggets. It's kind of ironic because they're both teams are playing each other. And then I'll go back to the Nuggets. He's got a left knee injury and their management. That's what they have listed.
So same thing. So management, meaning they're probably just managing some kind of, again, Ricky Rubio has been in the league for a good number of years. Mm-hmm. He's a veteran, normal wear and tear. So he probably has some kind of wear and tear on that knee. And as far as management, they're just trying to kind of manage in his minutes, his load type of thing for the for the rest of the season type of thing. So it may not be anything specific.
And then Eric Gordon's got rib injuries. He'll be out against the Cavaliers.
Yeah. So rib injuries again can be very tricky. And football can be even more tricky because they're more likely you can hit on it. The one interesting part about rib injuries is that oftentimes people think, hey, just a little bruise to the rib and suck it up, just like if you get a bruise to the thigh or the hamstring, you're ready to go. The unfortunate part is that anytime you breathe, your ribs expand. And anytime your ribs expand, if you have a bruise to that area, you're going to have a sharp pain every single time you breathe. If you sneeze, you're going to have a sharp pain. If you laugh, you're going to have a sharp pain type of thing. If you lay down on that side, you're not going to be able to sleep on that side, so then you have to sleep on the other side. So rib injuries can be lingering on, and they can be very painful at some times. Even as far as rotational movement as a basketball player, when you pivot, you got to turn type of thing. That can be very uncomfortable. Now, let alone if you go on a screen and you kind of go to the side and the opponent kind of gives you a little bit elbow, knowing that you already have a rib issue to the left side or the right side, and they're like, hey, I'm giving you a little jab in that area. That can kind of aggravate it. Now, there is equipment that the athletes can use underneath their jersey. There's certain patterns you can put there to protect it. But even then, at the same time, it's hard that you can't really put too much padding. Right. If you put too much padding, it can disrupt this motion.
Your shooting motion.
Shooting motion. Now their elbows are going to have to be a little bit further out, and they're going to shoot a little bit more weird than they're used to. So their mechanics can kind of be off. Now their mechanics off, then that can lead to some other secondary issue, like a shoulder issue, because now he's having some kind of thing. So even though a rib contusion sounds very simple, very easy, most people are like, just suck it up. It's a bruise, but in the rib area can be very complicated.
Makes sense.
Yeah.
And then, hold on. Andrew Wiggins. Oh no, he's out for personal reasons, so we don't have to cover that. Warriors announced Wednesday that Steph Curry's lower leg will be reevaluated in a week.
Mm-hmm. So the lower, So it's just a matter of waiting to see where he's at. Once he gets reevaluated, they'll probably do another MRI and see what's his progression in. Like I said, the fact that he hasn't returned to the court yet, first step is we want to be able to see him return to the court, start doing drills, one-on-one rehab with the therapist or the athletic trainers down at Golden State, and then eventually be able to return to practice. Once he returns to practice or scrimmage, or at least gets one or two scrimmages in there, or I think the Golden State is one of the teams that they tend, although I don't know if they'll send Steph Curry down to their G League, but I know I think they sent a couple of players down to their G League team, down to the Santa Cruz team to play. Once they go down there and they play at the G League, that's a good significant point that they're like, hey, this player's ready to return type thing. I don't know if they'll send.
They've done it before with Steph, right before he came back from the other injury. Okay. I know they've done it with Klay Thompson.
Yep.
When he came back from his second ACL, or was it a Achilles? I think that the second time it was an Achilles.
Correct. The first time was an ACL. The second time was Achilles. Yeah. So I say Golden State. I've read reports that they've done that before with their players. So what I would do is wait and see. Once Steph Curry does go down to the Santa Cruz team and plays, that tells me an indication that he's ready to return, and he's probably expected to return in about 3 to 5 days. So he'll probably go down there, get 1 or 2 games under his belt, get all that rustness out of him, and then be ready to go. Until that happens, it's just a matter of waiting game.
And then obviously Gary Payton II has a core injury. He'll be reevaluated in a month, according to Anthony Slater of the Athletic. But what's going? I mean, in your opinion, what's going on with him? Because he was playing recently before the trade. So you know what I'm saying? So that's. He was physically on the court like maybe like a month ago. Maybe if I got to go look at the exact dates, but he was literally playing not too long ago.
Correct. Yeah. So there's, I guess, I read a couple of reports, some issues, and I think even some potential lawsuits going on with Gary Payton type of thing. Gary Payton was taken and try to trade him. So one of the things I remember when I was in the NBA, that it was not a joke, but what would happen is that if you, as you're getting close to the trade deadline, right, like a month, a couple of weeks, if there was a player that you wanted to trade away, you would showcase them. Hey, all of a sudden they got minutes. Hey, all of a sudden, hey, this player's playing like 30, 25 minutes, where like in September, October, November, they were getting no minutes. All of a sudden in January, December, they're getting minutes. And if there's a player that you don't want them to trade away, you may limit their minutes. Mm-hmm. So it's kind of one of those weird things that oftentimes if you see around January or December a player that hasn't played at all, maybe he's played 2-3 minutes, all of a sudden they're playing 25 minutes. They're like, hey, that means that the team's trying to showcase this player to try to trade him. And I think that's what happened with Gary Payton. He was playing lots of minutes because they were trying to trade him, showcase it type of thing. And now that the trade did not go through, now they're like, okay, well now we go back.
Oh, it went through. It went through. Golden State accepted it.
Oh, they did. So they have him now.
Yeah,
so now
they have him. Yeah.
Okay. So what that probably tells you is that they identified the core injury that's probably a little more serious than what they had anticipated. And I think that's one of the issues that's happening now. So they went ahead and sat him, and they want to go ahead and make sure that that core injury that he has. Now, that core injury can be a couple of things. It could be either straight to their abdominal area. But when you think of core, it's not just your six-pack. Your core can be any muscle attached to your pelvis. Oftentimes, a core injury can be associated with a sports hernia or anything of that sort as well. Those kind of go interchangeable type of thing. So he may be experiencing some kind of degeneration either in the tendon, in the bone, or maybe experiencing some kind of sports hernia. But we don't know because they haven't really identified what that injury is. All they say is core. And when they identify core, when you think of core, is if you have your pelvis muscle, right, your hip muscles on both sides, any muscle, any ligaments attached to that area that stabilize your pelvis is considered your core. It's not just your six-pack, it's not just your obliques on the side type of thing. So it could be anything of that area. So what that tells me is that they probably identified something more serious than they thought was there, and now they're setting him out because they want to get him rehab properly before they put him back out in the court.
So Giannis, the wrist, right? Obviously, he didn't pay at all in the All-Star game, but he was there, visible for the activities. Mm-hmm. Just thoughts on that? They say that he's day to day, but with wrists, it could be a little tricky. And obviously, you don't want it with that type of injury. You don't want him playing in the All-Star game if they can help it, right?
No.
I mean, I don't think it's a big deal, but I guess just for Milwaukee fans' purposes, how would you rate that?
No, I mean, as far as playing the All-Star game, there's no need for him to play in the All-Star game. There's no point for him to play in the All-Star game. With the wrist injury, you want to allow him this time to be able to rehab, recover, and rest, and let that area kind of heal and be able to return type of thing. Now, is it in shooting hand or is it not shooting hand?
I don't. Okay. I'm not 100% sure.
We got to just keep an eye on it. If it's not shooting hand, it's no big issue. They'll probably just tape it up and ready to go. If it's shooting hand, then we got to just kind of keep an eye on it. Make sure it doesn't disrupt his mechanics and affect any of his dribbling type of thing, motion. But it doesn't sound, I think, from what I've read, that he's not requiring any kind of surgery at this moment. But even then, the whole risk reward, something that we've talked about in the past. Milwaukee is also in the playoff hunt and also in the championship hunt. I think they're in the top two, if not top three right now.
Yeah, at least the top three in the East. In the East, yeah.
Of them, along with the Boston Celtics, are probably the 1-2 favorite to make it to the Eastern Conference Finals and then potentially make it to the finals type of thing. So you don't want to do any type of surgery or hold off on any major surgery for Giannis until the end of the season. Otherwise, he's going to be out for the rest of the season. But as far as we're now, I don't anticipate any issues. He should be expected to return. He may miss a couple of games here and there. Hopefully, the Milwaukee Bucks do clinch the playoffs or clinch, first, second, or spot closer towards the end of March to allow him to either rest a week or two in April and then get him ready for the playoffs.
Okay, so Karl Anthony Towns, obviously Shams reported Tuesday during his segment with FanDuel TV that Karl Anthony Towns, they hope to have him back within the last 10 to 15 games, but he's out with a calf injury. And obviously, I know they're being very careful with that because, obviously, calf injuries, calf strains in the past have led to Achilles injuries. with Kevin Durant and others, right? So
yeah, the whole issue with Kevin Durant a couple of years ago when he was
yeah.
Golden State, that they identified him with the calf strain, then which led to an Achilles tear. Yeah, so I mean that's one of the concerns when you do get a calf strain. You want to just kind of keep an eye on it. Will it overload the tendon? If the muscle isn't able to take the load and contract while you're doing the movement, will it then be able to disperse to the tendon, and the tendon takes the majority of the load, which can end up in an injury or tear to the tendon type thing. But a calf strain is very similar to a hamstring strain. Both the hamstring strain and the calf strains, the gastric muscle in the calf area, are explosive, fast twitch muscles. Those are the ones that allow you to jump, accelerate as quickly as possible, type of thing. So they also can be very tricky. You may think you feel great, and as soon as you just jump up for a layup, for a rebound, you can pull that muscle, re-aggravate it again, just like with the hamstring type of thing. So you just got to kind of keep an eye on it. Obviously, you don't want Karl Anthony Towns to re-aggravate it, and then he's out for a long period of time, or tear it, or like I said, potentially tear his Achilles tendon, which then he's out for another 8 months, which will go into next year.
Okay, so I got maybe a couple more for you.
Sure.
Trae Young's day-to-day was excused turning for practice due. Oh, never mind. That's a personal reason. Never mind. You can't give your expert opinion on that. We got Cade Cunningham. He's out with a lower leg injury. Underwent successful surgery on Friday to stabilize and promote healing of his left feeble stress fracture.
Fibula.
Tibia. I'm sorry, tibia.
Yeah.
Stress fracture. According to The Athletic.
Yeah. So he had a stress fracture to the fibula. So he underwent a procedure on that part. The good news is the fibula bone. So in your lower leg, you have your tibia and your fibula. You have two major bones, or two bones in there. The tibia is a major bone. The tibia is the one that takes majority of the load. When you're running the fibula, it's almost considered a floating bone, so to speak. It does take some weight, but not as much as the tibia. So the good thing is that his fibula, so it allows him to be able to kind of return a little bit quicker because he doesn't put as much weight on it versus the tibia. If you guys recall back then when I was with the Lakers, was it Julius Randle had fractured his tibia. That requires surgery, and that requires 6 to 8 months because the tibia bone is a huge weight-bearing bone. The fibula, even though it does take some weight, is a lot less compared to the tibia type of thing. So that's he should be able to return pretty quick from it.
Okay, and then Anthony Davis's day-to-day is probable for tonight's game versus the Warriors due to a right foot stress injury.
Now,
nowadays, you can't tell if that's rest or, if that's an actual injury. Sorry, AD, I'm just being honest.
Yeah. Yeah. So I think I'm trying to remember if this is the same stress injury that he had. Remember back in November or December. I want to say it's the same foot. It may be something that either just feeling some soreness type of thing, or maybe I don't want to say aggravated it, but maybe having some residual issues with it. And it may just, like you mentioned, it may just be something as far as rest for him right now.
Okay.
Yeah.
Okay, I think we'll end up with a couple more from the Miami Heat. Kyle Lowry hopes to return to Miami starting by the end of February, according to Tim Rivers of the Associated Press, but it's his knee. It's his knee injury. He's been out for a minute. Just thoughts on that?
Yeah, so same thing, Kyle Lowry. I don't think they reported a specific injury with his knee type of thing. All they said is knee-wise type of thing. Again, Kyle Lowry is a veteran. He's been around the league. He's been in the league for several years type of thing. It may be some normal wear and tear. It could be some arthritic issues. It could be something as patellotendinitis, quad tendinitis. Anything in the sort. He may just have a little bit of flare-up, maybe some swelling kind of accumulated in that area from the normal wear and tear issues. He can have what's called chondromalacia in there. There's a bunch of minor things that basketball players or athletes in general, especially in jumping sports, from landing and jumping and pivoting and all that stuff, that they can irritate their knee, and they just have some minor issues, wear and tear.
And then Oladipo remains out with an ankle injury. Obviously he'll be out against the he was out last night, I guess, against Brooklyn. According to the Miami Herald.
Yeah, so the ankle sprains again, as long as it's a minor ankle sprain, you could be out anywhere between minimum 7 days to up to like 14 days for a first degree ankle sprain type thing. If we're looking at a second degree ankle sprain, you could probably be out more for 2 to 4 weeks. If we're looking at just a very mild ankle sprain, like I said, anywhere between minimum 7 to 10 days up to 14 days.
Okay, and then Chet. Obviously, this is supposed to be his rookie year.
Mm-hmm.
Obviously, he hurt his,